All right, now this video we're going to be talking about postpartum warning signs, especially postpartum depression. I have a list of the postpartum warning signs below. I encourage you to look over them. Your doctor will also give you a sheet of things to look for, and it's probably going to be more thorough than my list of just things to keep in mind of, how much bleeding is too much bleeding, if you have a fever, things like that. So keep that list handy and don't hesitate to call your care provider if you feel anything is off. One of the big problems that we have in this country is high mortality rates for mothers and babies. And the highest portion of that mortality rates is not during labor and birth. It's in the postpartum period because society tells us that you just had a baby, you're supposed to be miserable, you're supposed to feel awful and all these things. And it's causing mothers to ignore signs that they should have gone to the hospital for. So keep in mind that, yeah, you're supposed to be tired. I mean, besides the birth, you're taking care of a newborn and that's exhausting. But you're not supposed to feel like you're suffering or like you're absolutely miserable. Say, hey, here are the things that are going on. Should I come in? Is everything okay? It's worth it for peace of mind to be sure. I saw a really interesting thing that shows all of the care that we give to newborns, how many times they have to go to the doctor, for 2 days after birth, the week after birth, 2 weeks after birth, 4 weeks after birth, 6 weeks after birth, but the mother only gets one appointment to check on her well-being, and that's 6 weeks after birth. So take care of yourself, be patient with yourself, and please reach out for help if you feel that anything is off normal. Another thing to keep an eye out for is postpartum depression. I have a list below to give the basic signs of postpartum depression. If you meet any of them, I strongly encourage you reaching out to someone, even if it's just your partner, to say, hey, I'm really struggling right now and I don't know if this is normal or what, but I just need to talk to somebody about it. Share your feelings with someone. Don't keep them buried inside. And don't feel guilty if every part of being a new mom or being a mom again isn't rosy and happy. Like, don't feel pressured for everything to be okay. It's totally normal and fine if everything's not okay. And you just need to reach out for help and let other people help you. Also be aware if you meet criteria that increases your chances of postpartum depression, like if you had an epidural, if you had Pitocin for your induction, or if you had a C-section, or any kind of intervention or extra thing that was done during your labor and birth that might increase your risk of postpartum depression, then keep an extra eye out for it, okay? You're not gonna regret being mindful of your state of mind. And also, just because your baby is here and safe and happy and fine doesn't mean that you have to stop all of the relaxation techniques that you spent the last 9 months in a labor practicing and learning and enacting. They can still be beneficial. As you're nursing your baby at 3 o'clock in the morning, take some deep, calm, soothing breaths. You've earned the relaxation, and don't waste all these skills that you spent so much time learning and honing, I have below a postpartum depression quiz. Your subscription lasts at least 3 months after your baby was born, depending on when you signed up during your pregnancy. So have that, use that if you have any inkling that you might be struggling emotionally or mentally. And then seek out the help that you need after that. So your doctor's also going to give you a copy of almost the exact same quiz, if not the exact same quiz. So be mindful of yourself, be patient with yourself, and just enjoy getting to know your new baby.